Meet Roger. He has diabetes. Unfortunately, Roger developed a foot ulcer, and he now only has a 50% chance of surviving the next 5 years. There are no diabetic specialists in his village, and the nearest hospital is over 200 kilometers away, a major barrier to access. Roger is not alone. Over 450 million people worldwide have diabetes, and up to 1 in 4 of these patients can develop a foot ulcer. Tragically, 85% of all amputations are caused by foot wounds, often due to a delay in diagnosis. SnapSense makes monitoring ulcers as easy as taking a selfie. Our platform allows patients to snap pictures of their foot ulcers and answer a symptoms-based questionnaire. This data is made automatically accessible for clinicians to review. 40% of patients currently face a delay in diagnosis, increasing mortality by 25%. Our research-validated AI platform helps clinicians during the review process by automatically detecting the most urgent patients and makes sure that the right patient can be seen at the right time. We want to ensure that SnapSense reaches the patients that need it most. 4 out of 5 of all diabetic patients live in developing countries, and diabetic ulcers cause immediate amputation in up to half of diabetic patients in Africa. To treat a foot ulcer, it costs each patient on average between 2 to 7 years of income in Africa and South Asia. This has serious economic and social consequences as it usually affects economically productive age groups, leading to unemployment and loss of social security, which contributes to the poverty cycle. We will bridge the gap between the lack of doctors in developing countries and rapidly rising rates of diabetes using the benefits of high mobile penetration. For example, developing countries like India have 70% of their population in rural areas with limited health access. However, India also has the second largest mobile phone subscription base in the world. This will help us advance Goal 3 of the SDGs to democratize health, resulting in knock-on effects on Goal 10 by reducing inequalities in healthcare provision, and Goal 8 for economic growth by keeping our diabetic patients in the workforce.
Our competitors require complex hardware, making the monitoring process expensive and difficult to distribute globally. SnapSense only requires a smartphone to connect patients and doctors and automatically detects critical cases. The intersection of telemedicine advancements and progress in AI wound tracking presents an untapped opportunity in the diabetic foot market. Our primary market is worth $7 billion, which expands to $17 billion with other chronic and acute wounds. We'd operate on a subscription model, charging hospitals a monthly fee per patient. Adding our AI capabilities will increase the value we generate and accelerate healthcare access in areas where diabetic doctors are scarce. In the future, we aim to add functionality that allows clinicians to help monitor patients from more deprived areas or countries. Clinicians and patients we interviewed recognize the SnapSense's value. We're piloting our platform at St. Thomas's Hospital, and we'll have access to their image database of 2,000 patients to train our AI models. We're also building an inclusive global image dataset, partnering with clinicians from Harvard, Brazil, and India to ensure a robust and accurate ML algorithm. We have a great team with experience in medicine, biomedical and electronic engineering, and AI research at King's, Imperial and Harvard. We've worked in healthcare systems in the UK, US, China, India and Brazil, and we understand the problems patients face in accessing healthcare. We're supported by our mentors on accelerators such as Kickstart and We Innovate. We will use the St. Thomas's pilot to validate our prototype for a launch with other partners by July 2021. After our UK validation, we will start data collection with our global partnerships and run pilots in India and Brazil. Later, we will expand to other surgical site infections, such as C-sections, as suggested by the Lancet Commission on Global Surgery. The prize money would help us obtain and secure databases, train the ML algorithms, and increase global accessibility.
Our current prototype allows users to register an account and be directly prompted for their first upload. This makes it very friendly, also towards people that may not be very tech-savvy. After completing the symptoms-based questionnaire, the data will be directly sent to the clinician, and the user can simply log out and wait to be notified via email about their results. On the clinician's side, the list of patients awaiting review can be seen here. These are sorted in order of priority, which is assigned by our AI platform in order to catch ischemia and infections early. After reviewing a patient's picture, they do not need to worry about reminding them to upload pictures again the next week, since this process is fully automated by our system. Thank you for listening. During this 6-minute pitch, 18 limbs have been amputated due to preventable diabetic foot ulcers. So, we hope you will join us in our mission to save legs and save lives.